Hello everyone. In this session, we'll discuss the clinical approach to jaundice in adults, focusing on the causes, history-taking, physical examination, and formulating a differential diagnosis. Jaundice is a common presentation in clinical practice characterized by yellowing of the skin and sclera due to elevated bilirubin levels. Jaundice can be classified into three major categories based on the pathophysiology of bilirubin metabolism. First is prehepatic jaundice. Causes of increased hemolysis, such as hemolytic anemia, for instance, sickle cell disease or G6PD deficiency, or large hematomes. Next is hepatic jaundice. Liver dysfunction due to hepatocellular disease like hepatitis, cirrhosis, or drug-induced liver injury. Lastly is posthepatic or surgical jaundice. Obstructive causes like gallstones, cholangiocarcinoma, or pancreatic carcinoma, leading to biliary obstruction. The key to understanding jaundice lies in a thorough history. Ask about onset and duration. Sudden onset suggests acute processes, for example, cholangitis, while gradual onset suggests chronic liver disease or obstruction. Is there any associated symptoms? Dark urine and pale stools indicate obstructive jaundice. Right upper quadrant pain may suggest gallstones or cholangitis. Itching or pruritus often occurs in cholestasis. Don't forget the risk factors. Ask about alcohol consumption, drug use, family history of liver disease, or exposure to hepatotoxins. Investigate for recent travel, blood transfusions, or unprotected sexual activity, which are risk factors for viral hepatitis. Physical examination is crucial in evaluating jaundice. On inspection, assess for jaundice in the sclera and skin, paying close attention to the intensity and distribution. Palpate the liver for enlargement or tenderness, which may indicate a liver abscess. Palpation of the gallbladder may reveal Courvoisier's sign, a palpable non-tender gallbladder suggestive of malignancy rather than gallstones. Look for spider naevi, palmar erythema, and gynecomastia, which are signs of chronic liver disease. Ascites and peripheral edema indicate portal hypertension or hepatic failure. Scratch marks from pruritus suggest obstructive jaundice. Formulating a differential diagnosis depends on the underlying cause. For prehepatic jaundice, look for signs of hemolysis, such as anemia, dark urine, and splenomegaly. In cases of hepatic jaundice, suspect hepatitis, whether viral or drug-induced, or cirrhosis if there is liver tenderness and systemic symptoms like fatigue or weight loss. For posthepatic jaundice, consider obstructive causes such as choledocholithiasis, biliary strictures, or pancreatic carcinoma, especially in the presence of pale stools, dark urine, and pruritus. In summary, the approach to jaundice involves recognizing its different causes based on clinical history and physical examination. Categorizing jaundice into prehepatic, hepatic, or posthepatic helps narrow down the differential diagnosis and guide further investigations.